Hey folks, I'm Mike Evers, OrthoWorld Senior Market Analyst. This short video is part of an ongoing series covering the state of each orthopedic market segment. Today we're going to take a look at joint replacement, so let's jump right in. We estimate the joint replacement market grew in the mid-single digits to a worldwide total of $22.6 billion in 2024. It's the market's largest segment, it's highly consolidated, and a key battleground for orthopedic enabling technology. This year, we expect normalized procedure volumes, increased technology competition, and steady dynamics in the ASC setting. So let's talk about those procedure volumes for a second. Joint replacement procedures enjoyed significant demand and growth over the last few years, but backlogged and deferred procedures drove a lot of that upside. Most joint replacement players didn't surpass their 2019 sales until 2023. Knee and hip sales have a CAGR in the low single digits over the last decade. But even with the segment kind of returning to its baseline, there's a growing sentiment that that baseline has elevated a little bit. Favorable demographics, growing ASC capacity, improving technology, and patient activity levels could accelerate joint replacement's growth rate. All right, let's turn to enabling technology. Enabling technology for knee and hip replacement has really changed the competitive dynamics of those segments, and it could play an important role in driving future growth. Shoulder robots are really shaping up to be the next battleground between joint replacement companies. Zimmer Biomet got there first with ROSA Shoulder, and they believe it could change the standard of care. Zimmer Biomet also emerged as an early champion of optionality across its technology portfolio. In addition to expanding its own navigation and robotic systems, the company acquired OrthoGrid and partnered with Think Surgical to distribute the T-Mini handheld robot. Now, orthopedic enabling technology still has a lot of hurdles to overcome before it crosses over into the mainstream. However, the reception of shoulder robotics could give us an indication of where surgeons are on that adoption curve. And then finally, let's talk about the ASC dynamics for a moment. Companies are responding to the shift of procedures to the outpatient setting by streamlining their portfolio and their selling approaches. But it's really physical capacity that's been the rate limiter for ASCs for a long time. Beyond the absolute number of ASCs, many facilities are either out of date or too small to accommodate many complex orthopedic surgeries. Surgeons and orthopedic companies alike are working to make surgery more efficient, and the shift in surgeries to the ASC setting will remain a huge market driver in orthopedics over the next decade due to its ability to decrease cost and improve outcomes. But work remains to be done by both facility owners and device companies to clear these existing hurdles. Until then, we expect most major joint replacement players to continue to do about 20% of their joint replacement cases in the ASC. All right, let's wrap it up. Here's what we expect for joint replacement in 2025. Normalized procedure volumes, increased technology competition, and no major changes to the current ASC dynamics. So make sure you like and subscribe to our YouTube channel to get all the upcoming segment updates. You can also check out our updated orthopedic company sales matrix and a ton of other industry coverage over on orthoworld.com. Thanks for watching, everyone. I'm Mike Evers, and I'll see you next time.